Prescription for Learning. Created by Children's Hospital at Dartmouth, part of the Dartmouth-Hitchcock Medical Center.
And I was getting A's and F's and no one knew why.
Do you see yourself as being a bad kid or a good kid?
Bad kid.
Yeah? Mm. How long have you felt that way?
My whole life.
When I first came here, I basically spent most of my time sitting under tables, screaming and yelling and throwing books.
Attention deficit disorder is now the most commonly diagnosed psychiatric condition during the school years, affecting about 3% of American students. We'll show you where to get help and how medications, specific teaching methods, and daily structures can make a big difference.
There's no single test that can tell you have ADD, like an X-ray or blood test. Diagnosis is with a detailed history and a battery of tests done by a medical doctor or a psychiatrist. ADD is an officially recognized neurological disorder that shows up in brain scans, that results in a whole range of problems which usually show up in school.
I'd get interested and boom, I'd do really well. And then I'd become disinterested and fail with a 20 or something like that.
Tim Bliss has experienced the highs and lows of having undiagnosed attention deficit disorder.
So my parents really tried, and they had no idea, of course, what ADD was. And for a time, that was just a lot of yelling and discipline approach, and they made for a tough family scene for a long time.
Almost 2.5 million kids have attention deficit disorder. That means that in a typical class of about 20 students, you can expect that at least 2 or 3 of you will have ADD. To be diagnosed with ADD, you must meet at least 8 of these criteria within the last 6 months. Frequent fidgeting, difficulty remaining in a seat, easily distracted, difficulty awaiting a turn, often blurting out answers to questions before they've been completed, difficulty following through on instruction from others, difficulty sustaining attention, shifting from one uncompleted activity to another, difficulty playing quietly, talking excessively, often interrupting others, not listening to what others say, losing necessary things, and engaging in physically dangerous activities. These are the medical criteria established by the American Association of Psychiatrists. ADD runs in families. If you have it, it's more likely your mother or father has it. Today, several generations are often diagnosed at the same time. The inventor Thomas Edison is considered to have had it, so is Mozart and Einstein and the poet Emily Dickinson.
You might not think poets could have ADD because they need to focus so clearly on words for such a long period of time. But that confusion stems from the disorder's name.
The term attention deficit is completely misses the point. The word should be either variability or misplaced, something like that. But the attention is certainly present, and indeed it's often hyper-present. These kids and adults can hyper-focus at times. At times they can focus better than most people.
Ned Hallowell is a child psychiatrist who's written 2 books on attention deficit disorder with his partner, John Rady, who's also a psychiatrist. Recognizing and dealing with ADD may have some very important consequences in our society. Dr. Hallowell believes many kids end up feeling so worthless they fall into criminal situations. He would like to screen every child brought into the juvenile court system for both ADD and learning disability, called LD.
In fact, they're doing that out in Washington State, and they've had dramatic results. The kids who enter the program, for 40% of the kids brought up in the juvenile system have either ADD or LD or both.
Of those diagnosed teens in the juvenile system, 67% go back to crime if untreated. Those who are treated go back to crime only 22% of the time.
Those are the negative consequences of a disorder undiagnosed and untreated. But attention deficit disorder is not simply a disorder. It's a range of characteristics that have both negative and positive aspects.
And the term disorder I object to just because there are so many positive aspects. I think of it more as a syndrome than a disorder. The positive aspects, I think, outweigh the negative, and if you can take care of the negative, the positive are just wonderful. And these kids, adults, tend to be energetic, creative, open-hearted, tenacious, hardworking. They often have a special something about them. They often have a way that others find very appealing. They get people moving. They get things going. So,
Has everyone got their list of terms?
Tim is now 24, and this year he's taken a job teaching English to high school students at Willow Hill, a private school specializing in alternative education.
And their books? Have you got your book at least, Alex? I mean, it's pretty ironic that I'm a teacher now because I was such a jerk. I mean, I still label myself, in terms like that. I was such a jerk in school. Well, just tell us the plot.
But Tim is not a jerk here. He's a rare and valuable teacher. Many of these students have attention deficit disorder, and they benefit from his experiences.
And I think it would be a good idea, instead of drawing pictures, you took notes, especially if you didn't do your homework. With that kid in particular right there, he said, oh, I didn't do the homework tonight, and he wrote in his journal why he didn't do it. In tutorial, I asked him, and he was able to point out examples. He gave the plot of the story. He knew what an indeterminate ending was, and he showed these examples. He just, when it came to did you do the homework, he didn't have anything written down because he didn't write it down. So he said, no, I didn't do it. I didn't do any of it. Don't call on me. And turns out he knew what he was doing completely. So you just have got to find a way to get that out.
Managing ADD requires commitment from lots of people: the school system, parents, friends, and the student. Each person can help in different ways. Everyone can do better by learning about the disorder. Friends and parents can follow these tips. Look directly at the person when speaking to him. Use touch to connect. Speak the person's name. Here are some time management tips that have helped many people with ADD. Break large tasks down into small ones. Write lists of to-dos and cross off tasks as they get done. Develop a daily structure and stick to it. Ask friends and parents to help. They don't want to nag, and they need to know how they can help. Be specific with your requests. Attempt the difficult tasks when you're at your best energy level. Don't put them off until the end.
Why can't the English teach their children how to speak?
The Willow Hill School uses an annual musical to teach students about time management and to try out a variety of skills, from acting to designing and building sets and costumes and producing the playbill. The whole school stops all classes and entirely focuses on this production for 1 month. Maya Reeves played Eliza Doolittle in this production of My Fair Lady, but she had learned about transformation before this. She came to the school 7 years ago at the age of 11, with a diagnosis of attention deficit with hyperactivity and dyslexia, a learning disorder that occurs frequently with ADD.
I would just get very frustrated when I couldn't explain what I was thinking. I have a hard time translating thoughts into words. And whenever I would just get too frustrated to do much, I would sit under a table and throw a fit. But when they started working with me on that, I got a contract, which meant I would get so many points for behaving this well in class, and then at the end I would tally up the points and get a prize, like a candy bar or something. And also I was responsible for making sure I didn't have too many temper tantrums in class. And I would have a code word with each teacher that if I felt that I was going to get too stressed out, I would just say the code word and they would let me go out of the room for a little while and breathe and calm down, and then I could come back in when I thought I was ready.
That year, Maya was also put on Ritalin, and the combination of the medication and the behavioral changes started having an effect.
I didn't notice anything at first, but the teachers around me did. Dan, I was planning on doing sort of like an applique design on mine, sort of. They noticed that I was more able to focus and concentrate on what was going on. I wasn't going off onto side tangents as often, and I just generally, overall, my performance went up.
Maya doesn't take the Ritalin every day anymore. She's learned how to tune out some of the distractions that used to stop her from concentrating.
It's more when I'm taking tests that I need it. I've discovered how to like channel my abilities and disabilities into something useful. Like in discussions, I can hear 2 points at once and mull it over in my head at the same time. And Ritalin's not too good at that because it gets me to the point where I can only think about one thing.
This works, we're golden. Thank you, Chris.
Gotcha, Chief.
And what we find over time, rather than seeing the need for medication go up and up over time, as some people are very worried about, it actually goes down over time because people are better at targeting when they need their medicine.
Attention deficit disorder is often diagnosed in the early elementary school years. Bobby Judson was in 3rd grade when his teacher suggested his parents consider an evaluation.
From day one, he made his presence known. It's kind of like this tornado swept in. And I knew that he didn't seem to have any boundaries. He didn't know what his boundaries were.
It seems to me that this is a good time to talk about ADD. Now,
Ann took Bobby and his older brother Chris to their pediatrician, Dr. Fred Bogan. There they were both diagnosed with attention deficit disorder, or ADD. It was more obvious with Bobby, who also has hyperactivity. Chris doesn't have the hyperactivity, but he was still impulsive and easily distracted. 90% of the kids who are diagnosed are boys, but some researchers think that's because boys are more likely to be hyperactive, so they get noticed.
how long ago you took the medicine?
Write 1 or 2, maybe even 3 paragraphs that answer the directions.
We spent a day with Bobby in his classroom to see where ADD often first becomes a problem.
When you finish, what might you do? Bobby?
Proofread it?
That's one choice. Where else would you look?
This is the time to write a couple paragraphs about the black slave, Harriet Tubman. Over the next 30 minutes, Bobby fidgeted a bit, talked to his neighbors, did a little writing, and got up quite a few times to ask questions or just leave the room.
I noticed that he asked you for the bathroom key. Does that happen very often?
Yeah, these children need to get up and move, and there are certain ones that I will allow to get a drink, to use the bathroom, trying to keep it at a time when it's a work period, not a direction time. But that's their way of getting up and moving around. I also have locations within the classroom where they can change into another seat when they feel the need or when I ask them to, so that they can have a quieter place to work or a place to focus, or maybe a place where they can be discussing something with someone. Okay, you're doing very well so far.
This is not a normal day for Bobby.
Number 9, that choice
Usually
is to
he
think about
takes
something.
Ritalin, a stimulant drug that can help kids with ADD focus and not get so
And
distracted.
the list for the reading log is right here.
His mother agreed to send him to school without taking it so we could see the effect it had here.
It felt like I was I wanted to get up and just run around. I'm just not used to sitting down if I don't have my Ritalin.
Megan, scoop line up, please.
When Bobby went to lunch, he took his medication, and we stayed for the rest of the school day to see what differences were noticeable. Ritalin takes effect very quickly, but only lasts for about 4 hours.
On the back, I would like you to respond to 2 things here. Choose 2 to do. You can
Bobby still
retell
seemed a bit
a
fidgety,
trick. Now, who can repeat the directions generally?
but when it came to sit down and write, Bobby was able to produce several paragraphs. He finished the assignment in time to read it to another student, and then still had time to play a math game on the computer. The medication wasn't an instant cure. It took almost 6 months to find the right dose, and then it took time for Bobby to adjust in the classroom.
I think the marked improvement is the fact that he realizes that he can do better. He has really gained some self-esteem and some self-confidence because he has seen the actual results of his grades, and I think that that's made the big difference.
Those Ritalin sort of work. It works because it helps me concentrate on just one thing instead of concentrating on just like 500 things. It's been helping me calm down and just get my work finished.
Bobby sees his pediatrician on a regular basis to monitor the Ritalin. The drug has been used for decades and is considered very safe. It does not cloud the senses, and it is not addictive.
And there's no question, it helps kids stay focused. It helps them persist in tasks. It helps them complete work that ordinarily was difficult, if not impossible, for them to accomplish. It also helps, and I think this is very important, in terms of social skills. Hyperactive, impulsive ADD kids are not always fun to be around. They, you know, they're so bouncy, they're so pushy, they're so, they just don't have the self-regulation that other kids have.
Ritalin is only one of several types of medications that are used for ADD. Small doses of antidepressants can also help. But Dr. Bogan does not give medication to every child diagnosed with ADD. Many times, educating the family about the disorder and learning how to deal with it can make important changes.
Any problems that you think the medicine causes? Any side effects or things that you don't like about it?
Well, sometimes I can't. Sometimes when I eat it, gives it a little tangy taste.
Is that right? It seems like food tastes a little different?
Yeah, just a little. It depends.
Ritalin can suppress appetite and sleep and elevate blood pressure and heart rate. Changing the time when medication is taken or lowering the dose can often stop problems like these. Because Bobby only takes Ritalin during school hours, his appetite picks up once he gets home. Some kids develop facial tics or Tourette's syndrome, a serious neurological condition. This rarely happens, but these side effects need to be considered when a physician prescribes the medication. 80% of kids with ADD can get help with few or no side effects with one of the available medications.
Do you see a change in Bobby's appetite or eating habits?
I think at lunchtime he eats very little. He usually eats a pretty good breakfast,
Okay, check the board work. Your morning chores this morning.
What also helps Bobby is the structure of his class. Donna gives directions clearly and calmly. The pace is varied. Students don't spend all day at their desks. They present their materials to the class so that they can get up and move around. Bobby's teacher also knows how to design work assignments that take advantage of Bobby's abilities, rather than forcing him to fit into a structure.
He works much better on a computer. We wrote folk tales, and he was able to compose that, work from our graphic organizer, our planning for it, making some sketches and doing the different parts of the folk tale with pencil and paper, and then working on the computer was very helpful for him.
Creative teaching that goes beyond lectures and drills is critical for kids with ADD. They need variety, stimulation, and different ways to express their talents. And kids with ADD often excel in areas outside traditional academics, like applied physics and mechanical engineering, using visual spatial skills like computer graphics, and in theater.
I realized that I didn't have any disabilities on the stage. Jane saw some talent and really pushed for it. She's also the one that convinced me that I could go to Juilliard. I do my audition, have an interview, and a cold reading, no singing.
Maya will graduate this year, and she's applying to leading theatrical programs.
Specific language disability described as dyslexia. You put it in. Good. Okay. That's what it is. Here's your SAT scores, actually.
Oh, wow.
Yeah. This is called a non-standard administration of the SAT, Maya, if anyone asks you.
Right. Non-standard.
Yeah, non-standard, untimed administration. And when people might ask you about that when you go for your interviews, what that means.
It's basically large print, untimed.
Yeah, that's the way everyone takes them here.
Schools and universities are starting to make some important changes so that more students with attention deficit disorder have a chance at a substantial education. Some of the options are untimed tests, flexibility in seating arrangements, and allowing oral answers instead of written ones. The changes are slowly coming.
Okay, you may begin.
Changes in school policy, changes in social attitudes, and most importantly, changes in the lives of our future leaders.
I like him just the way he is. I like him off the medicine. I like his free spirit and some of his activities and all that goes with it. But I want him to be able to read and to get along with other people so that he can eventually channel that energy into something good or creative.
And I think what this school teaches people is that just because you bomb out in the way other people may be doing it doesn't mean you're dumb, doesn't mean all those labels that people assess. If you can't finish that test in 45 minutes like everyone else, does that mean you weren't as prepared as the other student, or does it mean it took you longer to read that or process that? But I've wrestled with accepting that diagnosis. I mean, to this day, I don't like any sort of labels. I think people learn in different ways, and so there's a part of me that still holds back complete acceptance of ADD until you come to a place like this and you see these children and these kids, adults even, who are just so similar. They just get distracted so easily. It's strange seeing myself in them now. It makes me accept it more.